Diabetes during pregnancy is a critical health concern that can affect both the mother and the baby. It can be categorized into two main types: gestational diabetes mellitus, GDM, which develops during pregnancy, and pre-existing diabetes, which includes type 1 and type 2 diabetes. Proper management is crucial to ensure a healthy pregnancy and delivery. This article explores the causes, risks, symptoms, complications, and management strategies for diabetes in pregnant women. Diabetes is a metabolic disorder characterized by high blood sugar levels, due to the body's inability to produce or use insulin effectively. During pregnancy, hormonal changes can lead to insulin resistance, increasing the risk of diabetes. There are two primary types of diabetes in pregnancy: gestational diabetes mellitus, GDM, which develops during pregnancy and usually resolves after childbirth, and pre-existing diabetes, which includes type 1 diabetes, an autoimmune condition where the body does not produce insulin, and type 2 diabetes, a condition where the body does not use insulin effectively. Several factors contribute to diabetes during pregnancy, including hormonal changes caused by pregnancy hormones such as human placental lactogen, which can lead to insulin resistance. Genetics also play a role, as a family history of diabetes increases the risk. Obesity is another significant factor since excess weight contributes to insulin resistance. Polycystic ovary syndrome, PCOS, a hormonal disorder, raises the risk of diabetes. Additionally, an unhealthy diet and a sedentary lifestyle contribute to gestational diabetes. Women are at a higher risk of developing diabetes during pregnancy if they have a family history of diabetes, excess weight or obesity, a previous history of gestational diabetes, high blood pressure or other metabolic disorders, a history of stillbirth or large baby, macrosomia, in previous pregnancies, are over the age of 25, or belong to certain ethnic backgrounds, including African, Hispanic, South Asian, and Native American women, who are at higher risk. The symptoms of gestational and pre-existing diabetes include excessive thirst and hunger, frequent urination, fatigue and weakness, blurred vision, unexplained weight loss, which is more common in type 1 diabetes, and nausea or vomiting. Many women with gestational diabetes may not experience noticeable symptoms, which is why routine screening is essential. Uncontrolled diabetes during pregnancy can lead to serious complications for both the mother and baby. For the mother, complications include preeclampsia, which is a condition marked by high blood pressure and organ damage, an increased risk of a C-section due to large baby size, infections such as urinary tract infections, UTIs, and a higher chance of developing type 2 diabetes later in life. For the baby, potential complications include macrosomia, excessive fetal growth leading to delivery complications, hypoglycemia, low blood sugar after birth, respiratory distress syndrome, RDS, jaundice, high bilirubin levels after birth, and a higher risk of obesity and type 2 diabetes in later life. Screening for diabetes in pregnancy is essential and includes tests such as the glucose challenge test, GCT, a preliminary test done between 24-28 weeks of pregnancy, the oral glucose tolerance test, OGTT, a follow-up test if GCT results are abnormal, and the HbA1c test, which measures long-term blood sugar levels for pre-existing diabetes. Early screening is recommended for women with risk factors. Managing diabetes in pregnancy involves several key strategies. A healthy diet is crucial and should include fiber-rich foods, whole grains, lean proteins, and healthy fats, while limiting sugar and refined carbohydrates. Eating smaller, frequent meals helps regulate blood sugar, and monitoring carbohydrate intake is essential. Regular exercise, such as walking, swimming, or prenatal yoga, is beneficial, with a goal of at least 150 minutes per week of moderate activity. Monitoring blood sugar levels is necessary, with fasting blood sugar maintained below 95 mg per deciliter, and post-meal levels below 140 mg per deciliter. Some women may require insulin therapy or oral medications like metformin, which should only be taken as prescribed by a doctor. Regular prenatal checkups help track fetal development and maternal health, and ultrasounds assess baby growth and fluid levels. Stress management through meditation, deep breathing, and adequate rest is essential, along with ensuring 7-9 hours of sleep per night. After delivery, Blood sugar levels usually return to normal in gestational diabetes, but women should have a postpartum glucose test 6–12 weeks after childbirth, maintain a healthy lifestyle to prevent future type 2 diabetes, and breastfeed to reduce diabetes risk for both mother and baby. Regular screening for diabetes every 1–3 years is recommended. Diabetes in pregnant women is a manageable condition with early detection, proper lifestyle changes, and medical supervision. Women at risk should undergo routine screening, and follow a structured care plan to ensure a safe pregnancy and a healthy baby. Proper education, diet, exercise, and medical guidance play a crucial role in minimizing risks and ensuring a successful pregnancy outcome. By spreading awareness and prioritizing maternal health, we can reduce the prevalence and impact of diabetes in pregnancy, ensuring healthier generations ahead.